Welcome to Chapter 2 of the Platinum Planner Preceptor Training Program. In Chapter 1 we covered the Preceptor, and Chapter 2 we covered the clinical student and aspects of them. So basically we're going to talk about the four main levels in the EMS provider by content and scope. Just briefly, they are the EMR, or Medical First Responder, or Emergency Medical Responder. They are the EMT, or basic EMT. There is the AEMT, or advanced EMT, also known as intermediate or specialist. Finally, there is the paramedic level. So those are the four levels, and we'll cover them more in detail in a moment. We'll also talk about balancing the prioritization of the needs of the student and the needs of everybody else, as well as what you should reasonably expect in your students' preparation and behavior as they arrive at your site. Again, the four levels. The first is the EMR, or Emergency Medical Responder, a relatively new term introduced into the EMS system. It used to be known as a Medical First Responder. Years ago, it was an Advanced First Aid or Ambulance Attendant even, going way back. Content and scope, very minimal anatomy and physiology training. Basically, their programs run anywhere from 25 to 40 hours minimally on up to maybe 60 to 80 hours maximum. Basically trained to treat life threats, and they carry very limited equipment. So pretty much anything you could fit into a car easily. So they do carry for airways, oral airways. They do carry a bag valve mask and are trained to assist or provide ventilations. Primarily, other than oral airways, they're trained in manual airway procedures. Their content and scope continued. They are trained to do manual blood pressures, pulses, count respirations, etc. They do carry medications, but the medications are intended for self or peer care in cases of neurotoxic exposure. They are trained to do manual skeletal stabilizations, hemorrhage control, and emergency moves, so they do not package a patient for transport typically. They're also trained in the automatic external defibrillator, CPR, and they can assist with normal deliveries. So that's the emergency medical responder scope and practice. The EMT, or basic EMT, or emergency medical technician, their content and scope, a lot more A&P. Typically, their programs start minimally 80 to 120 hours and can be as much as 200 or more hours. They're trained to treat additional life threats. They're also trained to transport. So in this case, they would be trained to package a patient. They can do everything an EMR can do, but in addition, they're also trained in use of humidifiers, Venturi masks, manually triggered ventilation equipment, automatic transport vents, and nasal airways. In the world of assessment, they're also trained in pulse oximetry and the automatic blood pressure. They can also assist in medications with the patient's own meds, and they also can provide some buccal or oral meds, oral glucose, for example, or aspirin for chest pain when you have a patient you suspect is having a myocardial infarction. Again, the manual skill stabilization is what the EMR was trained for. In the EMT, they're trained in mechanical immobilization, so traction splitting, masked or pneumatic anti-shock garments, C-collars. Also trained to package, rapid extricate a patient, as well as standard extrication and the use of a tourniquet. In their case, some extra stuff they can do is the mechanical CPR, so your thumpers, and they can assist with complicated deliveries. The advanced EMT, or AMT, again another new level, might be also referred to as an intermediate. There are different levels. There's the I-85, the I-99, which are being replaced by this advanced emergency medical technician in most areas. But they also may be referred to as a specialist or an EMTI, which means they can start IVs. There are a number of different levels of this type of beast. They're very in-depth in their A&P, trained to treat additional life threats. Again, trained also to transport. They're trained in everything that the EMT can do, as well as. They can also do some advanced airways, such as any supraglottic airways, so your esophageal tracheal multilumen airways, or combi tube, as one example. They do additional assessments for blood glucose monitoring. And in this case, they can actually administer some medications and start IVs themselves. For pediatrics, they can start an IO, medications. They are trained in the use of aerosolized, subcutaneous, intermuscular, nebulized, sublingual, intranasal, and IV of D50 and Narcan only. They are authorized to give nitro, sub-Q or IM epi, but not IV epi. Glucagon, D50, your inhaled beta agonists, such as like your albuterol, narcotic antagonists, and nitrous oxide for pain management. Finally, the paramedic or EMTP, or might be referred to as just a medic. Content and scope, very in-depth A&P, especially cardiology. They learn a lot more about cardiology. That would be the big difference between the paramedic and the advanced EMT. They're also trained in advanced airway things such as BiPAP, CPAP, needle decompression, chest tube monitoring, not placing them but monitoring them, percutaneous crikes, end-tidal CO2 or capnography, monitoring naso and orogastric tube, nasal and oroendotracheal tubes, positive end expiratory pressure devices, airway obstruction removal with direct laryngoscopy and the use of the McGills, but also EKG interpretation to include 12-lead, and blood chemistry. Also central line monitoring. They don't place them, but they can monitor those. IOs on anyone, not just peds. Venous blood sampling, administration of meds, ET, IV, gastric devices, rectally, IO, topical, central lines, physician-approved meds, and maintenance of blood administration and thrombolytics. They're also trained in the Morgan lens and cardioversion, carotid sinus massage, carotid sinus massage, manual defibrillation, and transcutaneous pacing. Needs of the students versus the needs of others. Patient safety is always our utmost. That comes first. Student and crew safety comes second. Then allowing the student to observe and perform tasks. You decide when a student can perform a task, not the student, not the program director. It's your patient. That patient is your responsibility. You decide when a student can perform a task and should not be allowed until you are comfortable that the student can perform this task safely. What should you expect of this student? They should not perform anything they're not yet trained to do in the lab or classroom setting. So a good question is, hey, you want to do this? Have you been trained to do it? If they say yes, then trust but verify. Talk to me about this. Explain to me the procedures of this before, again, you allow them to do it. And the first time you let them do it, keep a very watchful eye on them doing whatever the task is to make sure they can, in fact, do it properly. They should be able to comprehend anything that's been covered. So in other words, they're pretty knowledgeable on the subject matters, but they have not necessarily been trained to think outside the box. So they might not know what if a patient takes this type of medication on the medical side, but has this type of trauma, should you expect? They might not be aware of what that is. That's why they're out there, is to learn from your experience. You should expect them to be on time, prepared, and ready to learn. If the shift starts at 7, they should be ready to go at 7. They should not be walking in the door at 7. They should be dressed properly. They should have an ID in place that identifies them as a student. They should be willing to help you as well as learn from you. So if you need help putting the cot in the back of the ambulance, or if you need help making a bed, they should be willing to help you do that as well as to learn from you. Recognize they'll be nervous at first. They have not been out here. First time you go out and do a clinical can be pretty scary. And you should also expect them never to lie to you. They should have integrity. So in summary, there are the 4 levels of the EMS provider. Again, those are the first responder or emergency medical responder, the EMT or basic EMT, the advanced EMT may also be referred to as an intermediate, and the paramedic. We also talked about a reasonable balance and prioritization of the needs of the student and the needs of others, safety, 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 and then allowing the the student to observe and or perform tasks. Finally, we also talked about reasonable expectations. Basically, they should be expected to show up on time, be properly dressed and ready to learn, and ready to help you help the patients. This concludes Chapter 2.